If I had to choose an emerging setting to work in, it would probably be law enforcement. I have a lot of family members who are in law enforcement, and they're always coming to me for their injuries. I have an uncle that's the chief of police, and he comes and asks me about his low back pain all the time. And I have another family member who is the chief of fire, and does the same thing, because they don't really have a go-to athletic trainer for these types of work-related injuries. They usually go to their physician or a physical therapist. So I really think it's a great opportunity for athletic trainers to be in and kind of bridge that gap between their job duties and patient care. So why this setting really attracts me: when I was researching this setting, I found that athletic trainers can really be an asset to a multitude of domains of athletic training. My current job setting is a lot of injury prevention and injury treatment. But in the law enforcement aspect, there's concussion education that's missing from this job setting. There's nutrition counseling that's missing. There's stress reduction and maintaining appropriate blood pressure and just health education in general. One thing that I think I'm missing or not really getting enough of in my clinical practice right now is educating my patients, where it's very easy to say, this is the treatment and these are the goals and these are the indications. Sometimes a college athlete doesn't always necessarily care. And that's also apparent because they have a good relationship with me and I have a good relationship with them, and they trust that I'm making the right decisions for them, but that allows me to get almost lazy, almost complacent, that I don't really have to speak with the patient and truly explain what I'm doing. So I think that's a big opportunity in law enforcement, that you really need to sit down with these patients and talk about how what they're doing in their daily responsibilities and roles may be affecting their nutrition, their just overall well-being in general. And that's something that they don't have right now. So I think that lends to the biggest barrier I can see in working in this setting. Some law enforcement officers, just speaking from experience with my family members, they have almost a warrior attitude to them. They have to be the tough guy or the tough girl. And sometimes when they're injured, they may be unlikely to say anything because they don't want to be perceived as weak. So while this is not the military setting, I think there is a military aspect to law enforcement, and I think that would be a huge barrier, especially with concussions. Some officer may sustain a concussion and may be unlikely to report a brain injury and not tell the athletic trainer about their symptoms because they don't want to be out of the job. So I think that's the biggest barrier that I can see in working in this setting. But I really do think that this is a great opportunity for athletic trainers to kind of insert themselves in and make a huge difference. So I think if I had to pick, it would be law enforcement.